Welcome back to our channel, Libra Aesthetics and Wellness, for another Wine and Wellness Wednesday.
That's right.
I'm Aisha
Hello.
Thomas, MD, the Medical Director.
And I'm Lisa Parker, nurse practitioner.
And today's topic is a continuation of our Healthy Gut series. And we'll be talking about prebiotics, probiotics, and about the gut microbiome. So if you want to hear some more about this, continue to watch. So, we talked about the gut before, and you can look in our playlist below to get a more detailed overview of the gut. But today we want to talk about the microbiome, which is, sort of the organisms that live throughout your GI tract. And these are very important because it has a lot to do with your immune system. And that's always critical in this time.
It is.
So why is it important to know about your gut? And why is it important to have testing done? First of all, you can approach it in two ways, and I mentioned the genetic way you can test, as well as the whole gut microbiome we like to do here in the office. One way that we can map your microbiome is to do a stool sample, and we can find out using PCR technology what are the different organisms that live there. So we can know from bacteria to viruses to protozoa, to pathogen, to parasites, what lives in your gut and what are they doing in there.
Right.
Because we're supposed to have bacteria, but we're supposed to have good bacteria, and it's supposed to be in a balance. Okay, I feel like an analogy could be like when women have like a yeast infection, or when we have bacterial vaginosis, is because things are out of balance. You're supposed to have a little bit of yeast, a little bit of good bacteria, but when things go out of balance, you have those symptoms like you could have discharge and so on. And in the gut, you can have symptoms like chronic diarrhea. You can have intermittent abdominal pain. You can have constipation. And you heard, of course, of the irritable bowel syndrome. And some people manifest with like lactose intolerance or gluten sensitivities. And all of these could be the problems. Now, oftentimes it can also manifest as issues that's out of the gut. You can find people with mood problems, and it's really the gut is the issue, or people with skin problems. Especially on the on the forehead, you might have those breakouts. And some people have like the brain fog, and they feel like confused. And these can all be manifestations of the gut. So that's why it's important to know the microbiome. So one way you can test is by taking a stool sample and running it to see what lives there. So in terms of bacterial pathogens, we can see if there are things like Campylobacter or Clostridium difficile, E. coli, Shigella, Yersinia. All of these are different sorts of bacteria that can cause symptoms that range from, of course, the abdominal pain to the diarrhea. And we check for parasites, things like Giardia, things like Entomibia, and of course viral, like norovirus, adenovirus. And knowing that, we can see, is there an overgrowth of something that we might need to treat, depending on things. But we don't use that in isolation. We want to use that in combination to whether it's causing an inflammatory reaction in the host, which is you. So therefore, you'd like to know whether or not there are pro-inflammatory changes in the gut, or if there are any anti-inflammatory changes.
Right.
So therefore, you can know if you need to really treat, because there might be bacteria there, but it's not necessarily harming you.
Right.
Okay. Another way you want to evaluate the gut is by knowing the genetic testing. That would be how you react to the things that go into your body, whether it is food or medications, or even those same bacteria we talked about. So the way that the GI panel works is that it checks certain enzymes, because, for example, a huge enzyme that that is used in the gut, like histamine. If you have like a mast cell disorder or an issue in your gut, you might have those sorts of intermittent abdominal pain and swelling. And it could be because, the way you process histamine. And some foods are, they are sort of pro-inflammatory, like tomatoes and spinach in certain people, because they don't have the right enzymes to digest those. So the genetic test will help us to know. For example, you might need a histamine medication, to use. Also, if we do that test, it'll help us to know if you need to take prebiotics or probiotics. And I know you have, you'll be talking to us about that, Lisa. I can't wait to hear it. And it'll tell you if you need enzymes. It'll tell you if you have the sensitivity to gluten or to lactose. because remember, this is testing your own genes.
Right.
Because you inherit those genes, and it's seeing how you process foods, and it's seeing how you process medications. Because in our program, we find people who come in, let's say, with chronic diarrhea. They have to take medications for diarrhea multiple times a day, and it's so rewarding to see that when we find out what the issue is, whether it is the gut microbiome is the issue, or the way the genetically processed things.
Right. Right.
Don't you see how they respond? Isn't that
I do.
great?
I love it. Whenever we go through the results and we come up with the game plan, it's always really cool to see how the flashlights go off. You're like, oh yeah, I guess that really does happen. Oh, okay. And then when they start to change how they eat or times of days that they eat, because that could even be a factor, they're getting good results, and that's really nice. It's not something that happens overnight. However, when you work up to it and you notice that your body is working the best way that it can, you really start feeling better overall.
Yeah, it really is, because like I said, it's GI stuff, but it affects the rest of you.
Right.
So I'll mention a few things to look out for that you might know there's a gut issue. So I mentioned, of course, the irritable bowel syndrome, that sometimes you feel, so you sometimes feel like you need to go too much. I feel like I have those loose stools, or I feel constipated occasionally. It can be pure constipation. Some people just can't go, and they need to take medications to help them to go. Other people have chronic diarrhea. Most days out of the year, they go into the restroom sometimes more than 6 times a day. You might find people with intermittent abdominal pain. Just weird times you might have this pain, and the worst pain is, let's say you have to go on a stage and give a speech now. You're like, oops, I feel that pain.
Gotta go.
Yeah. Mast cell disorder, you might find patient have rashes on the skin, and I feel like the same thing happens in the gut. Maybe there's swelling in there, or some of these cells are the pro-inflammatory cells are so upset and angry, and they're all fighting. That's how I think about it. And of course, things like chronic reflux, because that could be the worst, when you always feel like, oh, I keep belching, I keep burping, I keep tasting the food. That's very upsetting. The other symptoms could be recurrent intestinal infection. You keep getting recurrent diarrhea, you have blood in your stool, you have this going on, you have fever, mucus in the stool, green stool. These are not normal. And of course, if you have numerous food allergies, that's something that's going on there. You're not reacting well to the food, something to evaluate. You might need the genetic testing there.
I would think genetic testing for sure.
So before I turn it over to Lisa, I'll tell you the gut is unique because it's really the only organ system that's autonomous, meaning you don't need the brain to tell it what to do at all. So it works on its own. It doesn't need any input from the brain directly. And I feel that's special.
That is pretty cool.
So please tell us a little bit about, prebiotics, gut health, probiotics, and
oh yes.
So on.
I know there's so much to find out about prebiotics and probiotics, and the most important thing that I've learned is they really do work synergistically. So you don't really want to have one without the other if you can help it. And there's lots of ways you can come by it. Of course, we always talk about the free way to do it, which is going to be food. So I'll tell you a couple of foods that are great for prebiotics and great for probiotics. And just try to incorporate these in with your life. General overall health is definitely something that's important to both of us. I mean, we try to live that way. I think anyone that comes in contact with us knows that we really want the best for you. So I think with us sharing this information, and please call the office if you want to get a link. We have Full Script, which is one of our supplemental pharmacies that we work with, so we can give you links. The best medication is really not taking medication. So if you can get away with taking supplements that really have the same kind of effects that medication would, without the side effects and things that go along with it, and they actually work, I think that's really the best thing. Yeah. So natural, all day natural, right?
Saying that, when you think about prebiotics, they have so many essential benefits themselves. It's just things like how just having a healthy gut impacts on your life. Having that, being healthy, it impacts on your weight.
It does.
It impacts on your immune system.
Well, yes. And your heart. Yes. So it decreases atherosclerosis, which is hardening of your vessels. So automatically you know that you're going to have the best pumping vessels going throughout your body just by what you take in as far as food or supplements. So that's pretty good.
Yeah, because it's almost like the prebiotics feed the good bacteria.
Right.
Because it's the right combination of fiber and,
That's exactly right. So there's like over 1,000 different species that live in your gut. So it's pretty cool to know that it's this soluble item that goes in and it feeds the good bacteria, and it really wants you to stay healthy and happy. So that's pretty cool. I like that.
Yeah.
So let's see. I also read an interesting one about a study on your immunity, because you had just started talking about it. So how about this? That in a preliminary research, the prebiotics boosted white blood cells and killer T cells and improved the responses to vaccinations as well. So they did test groups on children that had yogurt by itself and then the yogurt with the prebiotic in it. And in fact, 20% of the children had fewer daycare absences, fewer doctor visits, and took fewer antibiotics through the time where they were growing up through the study. So I thought, wow, that's pretty powerful.
On the right path, being young, isn't
exactly.
That
so they can create these great habits and kind of work their way through it. So let's see. Where do you find the prebiotics, you might want to ask, right? So you find it in fruits and vegetables, especially those that have complex carbohydrates like fiber and some resistant starches. And because they aren't digestible in your body, that's what gives them the opportunity to feed the good bacteria, or your microbiome, like we keep talking about. So a few things that you can find at your local grocery store or at Whole Foods, because some stuff they don't carry at the regular grocery store, but you can find it at Whole Foods, which is nationwide everywhere. They have chicory root. So that's often used as a caffeine replacement in coffee. It promotes gut bacteria, reduces constipation, and also helps break down fat, which you started talking about. Great for weight, great for reducing constipation as well, which can be quite painful actually. There is a Jerusalem artichoke, which is also known as an earth apple, which you can find at Whole Foods. That's kind of got me going, like, where would I be able to find something like this? And man, it's been around for centuries. So it provides about 2 grams of dietary fiber, which of course is a thing to feed your good, healthy gut. Garlic, in fact, is a prebiotic. It gives flavor to your food, and it also promotes the good bacteria. Other ones can include raw apple cider vinegar, which everyone's heard apple cider vinegars for years and years, right? Apples, which we all know an apple a day keeps a doctor away, and bananas as well. So that's wonderful. Free, and also you can take supplements. So there you go. We got probiotics, which is different from the prebiotics. These actually contain live organisms, and they feed specific strains of bacteria that are also part of your healthy gut. So for your immune system, it helps prevent harmful growth bacteria. It strengthens your immune system towards allergies and any other kind of autoimmune diseases. It helps your digestion and reduces cholesterol levels, reduces your blood pressure, improves your absorption of vitamins and minerals, which I think we find most important whenever we meet people that have issues with their gut. Is we always are very concerned about the absorption. So we try to get you on a little bit of a gut health and on the right kind of diet that works best for your body. We do try to get you an infusion just to kickstart and really get your body jumping and pumping the way that it's supposed to. So I feel like our patients really benefit from that, because absorption, we have to heal it first, right? So we got to make sure that we create a nice, calm, soothing environment in there, so all your soldiers that are marching everything through pick up everything that they're supposed to. So something else that we didn't really think about, and because you said it's one complete system starts in your mouth, right? So taking probiotics also decreases your dental caries, which is bacteria in your mouth. So hey, that's not bad either. So some examples would be kimchi, kombucha, which I found at the local health place, and I love that. Do you like it?
Yeah, it's okay. I do like the little kick it can give.
Yeah, it's got that little bit of kick. Actually, I have to thank you, Cindy, because you're the one that turned me on to it. So it's really good. Cottage cheese, sauerkraut, and of course, everyone always knows about yogurt. for a probiotic. Everyone always says take that when you take your antibiotic, things like that. So I definitely say do that, but you want to make sure you get it that has live culture.
Yeah, an easy way to think about it is fermented foods. Because,
fermented foods.
Yeah, because little organisms are what cause the fermentation process.
And if you feel like you want to do the natural thing, you can actually ferment them in your own home as well. So
I heard about that bear going on.
Yeah. He's so crazy. So I'm actually going to leave you tonight with a recipe that I found. It's a probiotic recipe. So it's called a green kefir smoothie. I know a lot of people like to take to do smoothies, and it's kind of like not a trend, but it's actually part of everyone's diet these days. They're quick, they're easy to make. So anyway, so green kefir smoothie. You ready? So get your pen and paper. I'm about to give this to you. Here are your ingredients. 1 cup of kefir. So kefir is actually like a type of a...
It's like a yogurt.
Like a yogurt. Yeah, like a liquid yogurt. That's the best way to describe it. 1/3 cup of cucumber. 1/2 of a chopped up apple. 2 to 3 tablespoons of an avocado. 1 handful of baby spinach. And 1 tablespoon of fresh lemon juice. It just sounds good.
Yeah, it sounds savory though, but a little sweet with the apple. We'll have to try it and see.
Yeah.
Have you tried it?
I haven't tried it,
okay,
but I am gonna try it.
Yeah.
You can best believe that, because I was like, that really sounds pretty good, because you get the sour from the kefir, the little sweetness from the apple. So I like everything that's in it. So I won't be making any adjustments when I make mine, but you can make them if you want to.
Well, you know, this brings me to the point of thinking of balance, just like here at Libra Aesthetics and Wellness is the balance of inner and outer beauty. And of course, the prebiotics, probiotics, you need the stuff to feed the good bacteria.
Right.
So just in your everyday life, try to, find that balance. And of course, look below in our description box. You'll find our website, you'll find our Instagram, everywhere you can reach us. We're happy to meet you for, a consultation. So you guys have a great rest of your week. Thanks for joining us this evening.
Like us, subscribe to us. We're glad you're here with us every week. We really look forward to it.
Absolutely. Good evening.